strike on the 21st and 28th of December. It's the latest announcement that adds to a winter of disruption. Rail staff, nurses, postal workers, teachers and driving examiners are all taking action. So how will this affect people and businesses in the run-up to Christmas? And are we prepared to cope with the resulting strain? Joining me now, Kate Nichols, Chief Executive of UK Hospitality, and Dr. Leyla Hannbeck, Chief Executive at the Association of Independent Multiple Pharmacies. Thank you both so much for joining me. Kate, I'll come to you first. To what extent is this adding to already existing pressures given the economy weakening in your industry?
This is really significant. It's going to have a devastating impact on the hospitality sector, not least because we lost the last two Christmases to COVID. Christmas so important for our businesses to be able to generate a profit, to be able to get some much needed cash in the coffers, repair shattered balance sheets and cash reserves, and to have a third Christmas in a row taken away from us potentially by strike action, incredibly devastating. We're seeing businesses facing high levels of cancellations, particularly in towns and city centres, and our staff unable to work extra hours, extra shifts or get into work at all in the next week or so.
And do you think those cancellations are linked to strike action?
Undoubtedly, we saw around 20% of cancellations coming through as soon as the strikes were announced, when they were confirmed at the beginning of this week, and when further strikes were announced for the Christmas period, cancellations significantly increased. And this is not just Christmas parties and large-scale Christmas events. It's also families coming in over the last weekend of Christmas shopping, coming to entertainment venues, coming to theatre, coming to shop, but also workers and small-scale family activities as well as hotel bookings that were confirmed for people visiting family and friends over Christmas. And it's explicitly linked to the strike action and the lack of confidence that people have that they're going to be able to travel, be able to make those commitments and get back. So it is going to have a really significant impact on our sector. We estimate that it's going to mean that we lose as much as £1.5 billion in revenue over the next 2 weeks. And that's almost as significant as the impact of Omicron last year.
Dr. Hannbeck, I mean, the broader health industry, if we just touch on that first, clearly participating in the strikes. Can you understand the reasoning behind strike action?
Well, from pharmacy perspective, I can talk from a pharmacy perspective, and for years we have been underfunded in terms of like other activities that we deliver. Independent pharmacies, they've got over 90% of the activities NHS related. So they are very much dependent on the income that they get from the NHS to survive and deliver the patient care that is, particularly this time of the year is very important. But for years, we have been underfunded. We kept our doors open throughout the pandemic. We are having challenges with workforce. Our energy bills are rising. Inflation is going up, and we are with the same funding that we had 5 years ago. So a lot of pharmacies are struggling to keep their heads above the water. And also the medicines prices are going up. So it's incredibly challenging for pharmacists at the moment, as healthcare professionals, during these circumstances.
So what action are you taking at the moment then?
What we are doing, we are discussing with the government, we are raising the concerns in terms of like the fact that a lot of our members are struggling to keep their heads above the water. We've seen pharmacies that have had to shut their doors for good, those who are temporarily shutting their doors because they simply cannot handle the fact that there's workforce challenges and there are other challenges related to funding. So if nothing is done and this situation continues and the medicines prices keep going up and nobody bothers about that, then we'll see more pharmacies, shutting their doors for good, and communities end up being affected. The patient care and that accessibility that the patients get by speaking to the pharmacist will be affected.
Kate, talk to me about the sense of feeling your workers and staff have with the strikes that are going on. Even if they are not striking themselves, is there a sense of solidarity and understanding with those that are striking, or is there disappointment?
Well, I think there is obviously an understanding about the wider situation that lots of public sector and private sector workers are facing in such a high inflationary environment. However, what overwhelming sense is one of devastation, particularly for the small business owners in our sector who are really struggling with a cost of doing business crisis, soaring energy bills, soaring food costs, and a cost of living crisis where they are staring down a downturn in consumer spending and are facing a very bleak winter next year when they're coming through into the beginning of the year. So I think the overwhelming sense is one of despair that they are losing again their most valuable trading period, something that was going to be essential for many of them to get through the bleaker months of January, February, March, and beyond the April cliff edge of the energy support ending from the government. So I think that's the overwhelming sentiment. 1 in 3 of our businesses have no cash reserves. 1 in 2 are not making a profit yet post-COVID. So you really are facing a situation where many are clinging on by their fingertips and may run out of road as a result of not being able to trade over Christmas.
And Kate, do your members blame the government for the situation that we're in? I mean, obviously, the government did provide a lot of support to the hospitality industry only recently during the pandemic, which was not of their making in the first instance. Do they have understanding for where we are now, or do your members ultimately blame the government?
Well, the government did provide hospitality with unprecedented levels of support during the COVID crisis, but our members are facing a crisis, a perma-crisis, an omni-crisis that's not of their making. They were forced to close during COVID. That was not their fault, that they couldn't trade and they weren't able to keep their heads above water. You've then had high inflation. You've had a war in Ukraine, which means they're facing 300-400% increases in energy costs. And now you've got rail strikes, which are depriving them from earning much needed revenue to be able to stand on their own 2 feet. All we want to do is to be able to trade our way out of the crisis that we've had. It's not our fault that we're not able to. So we urge all sides that are involved in this dispute to redouble their efforts, to come together, unions, employers and the government, to reach a resolution, avoid the hospitality sector once again being collateral damage in a dispute, and make sure that these businesses are supported so that we can keep these valuable community assets and the jobs that they provide across the UK as a whole.
And finally, Dr. Hannbeck, I think I'm right in saying that your members haven't striked, but you're engaging with the government. Is there things you can do to help other parts of the NHS during the strikes or not?
We simply cannot be asked to do more unless there is additional funding coming our way. We are exhausted, we are underfunded, we are barely, trying to get our heads above the water. It's terrible out there at the moment for a lot of people. They are really struggling, and I think if there is no emergency funding coming in, we simply cannot be asked to do more. We are engaging with the government, we're talking with them, we are raising with them the importance of patient care during this winter, and if pharmacies are not able to do that because of the lack of funding and lack of support, then those communities end up suffering at the end of the day, and our patients, as healthcare professionals, we don't want to see any of our patients suffering.
Kate Nichols, Dr. Leyla Hannbeck, thanks so much for joining me. Very much appreciated. Now, people are